There was a situation once where I was referred to a patient in pediatric clinic. He was a teenage boy with autism, and the nursing staff called and said, you know, he won't sit down for his shots, he won't sit, he won't sit, he won't sit. And they called me kind of on the fly, I had nothing with me, and I ran over to clinic, and I saw him, and he looked terrified. And there were 2 nursing assistants there with syringes and needles in hand. And I said, well, does he have to sit? And they said, well, that's what we always do for shots. I said, but does it have to be that way?
Do you want to see what we are going to do with the bubbles? We're going to use your masks to blow bubbles. So you can practice blowing big, big breaths through them. When you see this mask downstairs, it's going to be connected to a big straw. And as you blow really nice and big, you'll also breathe in a sleeping medicine. It has a funny name. Do you want to know what the name is?
Yes.
Anesthesia.
Anesthesia.
Good job. That's a hard word to say.
Child life specialists are really important to have in hospitals because we do things to make everyone's jobs easier. We make it easier for doctors to do their job, nurses to do their job, patients and their families to come here. By really sitting down with families, giving them time and attention that they need, and helping them to understand what's going on.
One really cool thing that Allison did for us was take a doll that they had and fit it with a halo and a trach, both of which Ellie has now. It was an idea that Allison just took on and made it a reality so that Ellie has something to look at that's not just herself in the mirror. It's also something that we've taken with us when we go see her friends. All the kids gave it hugs so that the doll could come and give Ellie those hugs. Her friends can interact with an object that helps to explain Ellie's injuries and her course of treatment.
Our child life specialists do so much here. They just help improve the overall patient experience, not just for the patient, but for the families.
We help kids cope with whatever is happening in the hospital.
Getting a specific craft project. They got some room decorations that one little boy would like.
We carry along with us our bag of tricks. So when you see a bag with a light wand sticking out or a fart machine, you know we're gonna be different than someone else.
We solely depend on donations just because we don't really have that large of a budget from the hospital. So it's all kind of from the community, which is pretty amazing.
So we use fundraising dollars towards teaching dolls that have practice IVs where we can work with a patient to practice placing an IV prior to it happening to them, or inflatable lungs to do asthma teaching. We have used fundraising dollars in the past to buy mini MRI machines so that kids can practice with a doll.
Just anything to help kids cope and play while they're here.
A hospital is a very boring place for a child. It's not only boring, it's very frightening. And the work of the child life specialists really reduce that anxiety, reduce that fear, and actually bring joy to the life of a child during their hospital stay.